Seems to be doing that where it clouds over and goes in.
Berkshire weather.
At least it's not raining or snowing.
Right? We love it anyways. Yeah. All right, we have some people signing on. Welcome, welcome. All right, since this is being recorded, we can get started. Thank you all for joining me today. Really appreciate, I know I'm going to love your input on this topic. So first of all, we want to thank our sponsor, Lee Bank, which, you know, a great community bank, always behind so many of the nonprofit organizations in our area, which is really essential because we all need the help. And this morning I am here with our panelists, which is Glenn Tamir, right? From Biomedical Enterprises, which is an authorized representative for Errol's House. Is that the correct way to say that? They provide
Eris or Active Pure.
Okay, Active Pure. Okay. They provide air purification solutions from combating COVID-19 and other viruses, pathogens, and bacteria, which in today's world is really important. Ellen Shanahan Performance Solutions. They offer workshops and coaching and aid in personal and professional growth for individuals, organizations, and companies in our area. And Kenneth Farber from Community Health Programs, which is a network of health centers and caring professionals that provide outstanding primary and preventative health care for everyone in the Berkshires. So welcome and thank you so much for joining us. This morning, we're going to start off with Glenn, who's going to give us a little background on Biomedical Enterprises and then introduce Daniel. Take it away, Glenn.
Okay, if you would please give me permission to share my screen.
Yeah, let me get rid of this.
Okay, there we go. Okay, thank you very much. Welcome everyone, and thank you for taking the time for this very important webinar. My company, Biomedical Enterprises, has been working in the healthcare industry for over 30 years. And I'm honored to be representing Active Pure, which is a division of the Eris Corporation. Eris is an American-based manufacturer. They manufacture in the United States of a variety of cleaning solutions, including what many of you are probably aware of, the Electrolux vacuum. So it's a well-established company, and they have been in the air purification market now for over almost 20 years. So they have a lot of experience. For the first time in history, customers expect the businesses that they visit to keep them safe and to ensure that the air that they breathe and the surfaces that they touch are free from viruses and bacteria. Since people can introduce viruses or bacteria into a space anytime they walk through your door or move around your location, it's important to do more than clean and sanitize your location a few times a day. Air purification and ventilation are central in return to work strategies as employers aim to reduce the spread of airborne viruses and assure their employees, customers, and guests that the indoor air is protected from contaminants. Yet not all air purification systems are created equal. Installing the right one can make a huge difference in improving the indoor air quality, employee trust, and the company's bottom line. Active Pure is proactive, effective, and cost-efficient, delivering the highest standards of care for indoor air. I'm very pleased to be joined today by Daniel Garstang. Daniel is Active Pure's Vice President of Operations. He has 25 years of safety design and execution experience within high exposure industries, helping them manage serious injury and fatality exposures. He's served on various industry safety committees, co-authored several papers on safety management and has served as an expert safety witness on several occasions. Daniel has designed and implemented safety management solutions globally. He's currently supporting customers within the ActivePure network to understand how to design and implement a risk management solution to mitigate the risk posed by pathogens like COVID-19 in the workplace. I look forward to this important discussion, how ActivePure technology can provide the highest level of air purification possible for your customers, employees, and guests. So I'm very pleased to have the support of Daniel, and I'd like to pass the comm over to him at this point.
Well, thank you very much there, Glenn, for that introduction. Let me just bring up my screen here. Okay, well, welcome everybody, and thank you for those online and those reviewing this presentation after the fact. I appreciate your time in taking to review this information. I'm currently coming from Las Vegas, Nevada. I'm at the ISSA conference, looking at some of the industry trends, and I'll actually convey some of that information to you all today from information that I've gleaned over the last couple of days as well. So when I was asked to do this presentation, I was thinking it from the perspective of what am I currently encountering with our customers? What is some of the challenges and the hotspots that we're seeing in terms of how do we bring in a broader exposure discussion, not just about the obvious issues of contracting COVID in the workplace or other pathogens for that matter. But what other exposures do we have in? I come from a safety background, and as you can probably tell by my accent, I'm not from the United States, I'm from Australia, and I've traveled the world over the last 20 years, designing solutions primarily in the oil and gas industry, where we have high exposure and managing a various numbers of serious injury fatality protocols. And sometimes in some operations, we get as high as 20 different protocols that we manage. Everything from preventing a facility from losing primary containment, and that obviously from a hydrocarbon perspective is a bad issue, right down to how do we ensure people working at heights or transporting to and from locations where doing things wrong can result in bad things to people, to the environment, to assets, and to reputation. And when I've looked at this from the perspective of indoor air and what is happening in the COVID, the SARS-CoV-2 issue resulting in COVID-19, what everybody in the world is now encountering is how do I prevent serious injury, fatalities, and how do I manage all of that given what is happening in the workplace. And there's so many people that are confused as to what to do. So I thought in this presentation, I would bring provide you a bit of an overview of what is happening, provide a bit of an overview of a risk management approach. I want to touch very briefly on OSHA, and I don't want to turn this into a regulatory conversation, but I want to sort of bring your attention to the 10 elements that OSHA is requiring to do, and just give you a high level. I'll also provide an Easter egg for those afterwards that you can pause the video and have a look in terms of some of the things as more of a checklist for you later on that can be reviewed. I also want to talk about some engineering controls and what engineering is on the marketplace, and help provide some education about the passive systems and the active systems that are in place, and the pros and cons associated with those as well. So without further ado, let me just go on to the next slide here. And we have Dr. Deborah Birks that is in our organization now. Dr. Deborah Birks is, as many of you know, was involved very initially in leading the United States charge on combating the COVID-19. So Dr. Birks has very kindly created the first couple of slides for me to provide an overview to you all about, what's happened, and so as we look back on this, if I look now, I said it's December, in not too long, with Thanksgiving coming up to next week, it's December, and as we come rolling into December, we're rolling into the third year of living in the pandemic, which is an unfortunate milestone. But you know, if we look back from the very beginning when this sort of occurred, started coming to prominence in December in 2019, as it rolled into March, on the initial surge, 100,000 Americans started dying from exposure to COVID-19. And as we rolled into June and August, you know, as the primary surge across the Sun Belt, a further loss of 100,000 Americans. In September into 2021, the surge beginning primarily in the northern part of the United States, in the heartland, as cooling starts to occur. And obviously that starts to change the social dynamic of how people interact. And that brings people closer together, which also increases the transmission. So again, another further 330,000 people lost. And as we get, as you can see, the trend line going through, as the different variants have come in play, you know, suddenly everything's about the Delta variant. And the Delta variant, you know, spread across the Sun Belt, spreading into the Rocky Mountain states. And then as of March 2021, you know, further 230 Americans lost. And then as we get into November, March, you know, we're coming in with a very high level of potential for this variant to cause a lot of issues. And it's extremely worrying for those on the front line managing this. So when we look at the Delta variant, 2.4 times more contagious than the original circulating strains, you know, certainly what that means is easier to contract the virus, which is, you know, obvious problems, especially as we look at how the virus has transmitted and the fatigue of everybody trying to manage this. So as the longer this goes, the harder it becomes, and the messaging and the risk management aspect of this. I mean, I was having a conversation yesterday with a university on the West Coast, and they're now not just trying to manage, say, the SARS issue, but they're also trying to manage the combatant of the flu that's breaking out in that location. And there's certainly what they'd coined as needle fatigue. People try to say, well, we're struggling to get their students to get flu vaccinated. So it's definitely a challenge for many people. But as we look at, as we're going into the fall, 80,000 cases a day versus 35,000 cases the previous year in terms of that. But as we start to see some flattening of the curve, and I guess that's terminology that's well versed now in most vernacular. It used to be only the vernacular of epidemiologists, but it seems to be common speak nowadays. But what's really become really evident, especially as you've seen on recent media, is the impact of the third vaccine, you know, and obviously the push to do that. I was speaking to a professor yesterday at the ISAC conference who presented data that was suggesting that, you know, with the third vaccine, particularly with the vaccine, I paid attention primarily. I was selfish in this regard. I was looking at the Moderna, and with my Moderna vaccine, I latched onto that. It says I'm 75 times better off if I have the third booster shot, which obviously is having a big impact on boosting immunity. So in summary of the sort of the way forward, you know, increased layers of protection are certainly required. We definitely need to protect those that are more vulnerable. That has not changed in terms of the immunosuppressed and those people who were you know, high exposures, especially as we're starting to get into the winter, and we're starting to, obviously Thanksgiving's coming up, Christmas coming up, and we tend to socially gather further. So increased layers are definitely protection. And Dr. Bergs would love to sort of, if she was here personally, she would be saying masking indoors is still important. At this conference, and we're all wearing masks, and everyone's is making sure that they're practicing safe practices. Minimizing unmasked in indoor gathering. Proactive testing, that's definitely a challenge in terms of how do we keep more data in so the authorities can track and trace, and looking at new technologies that are available. And I'll talk a little bit about that going forward very shortly. But what's very evident is that as we've gone forward, I think we've had the as I was saying to my fellow panelists before we kicked off on this, I mean, the war on pathogens is definitely out there. We've had the war on drugs, we've had the war on terror, and as we go forward, the war on pathogens is certainly a major consideration. Everybody's a lot more educated now in terms of the pathogen issue. And I'm sure we've heard issues in relation to pathogens that are resistance to modern drugs, especially for those that are working in into the hospitals with the hospital-acquired infections and the issues they've had with very pathogen resistance. But I think what's really hit home to a lot of people, this is no longer a healthcare problem. This is real people, real lives, and real impact in all of our communities. And we all have an impact. We all have a part of the solution as we go forward in terms of addressing. So most of us have seen, we obviously know about the SARS-CoV issue, but when you look at the pathogen triangle, when you're looking at RNA and DNA-based viruses, they're very much at the bottom of the triangle in terms of pathogens, and it's causing a lot of issues. And they're viruses that, from a technology perspective, are relatively straightforward to deactivate. But as we go further up the hierarchy of pathogens, as you're starting to get into the MRSAs and the C. diffs, which again, the hospitals and the healthcare facilities have been trying to manage for years. This is certainly, a growing awareness for people around, the challenge of how do we manage pathogens going forward. And this is certainly, since the pandemic occurred, and there's certainly a rise since the pandemic. In fact, a lot of the researchers are saying they've essentially lost a decade in terms of progress against others, types of pathogens that are problematic and still need to be managed proactively, because really everybody has sort of dropped all their resources and just focused on, how do we get the vaccines designed? How do we get the biologics designed? And that has primarily been a focus for so many organizations that have been traditionally focusing on other pathogens that are in the workplace, or rather in the hospitals, etc. So I did want to talk about OSHA as well, in terms of, because OSHA and the CDC have come out with a number of requirements that, unless you actually have a safety person in your organization, most people will not really recognize the fact that, other than traditionally managing slips, trips, and falls, it's the first time they've had to manage anything that has a serious injury or fatality consequence, and barriers and layers of control that need to be put into place is not something that is readily in the thought process of a lot of smaller businesses. So, there was a recent rule that was put out by OSHA a couple of weeks ago. I'm sure if you saw it was about 2 Fridays ago, it kind of erupted onto the television screens in relation to all businesses that have 100 or more employees must have their employees vaccinated. And that certainly is being challenged right now. But the intent is obviously, if we can put a barrier in place and having staff that are vaccinated, then we're making significant impacts as a bioengineering control to mitigate the virus. But I'm not going to go through all these 10 elements, but I think it's important for businesses to understand that you need to pay attention to what the OSHA guidelines recommend, and go through those specifically, and just make sure that you, in your workplace, have those barriers put in place. And a lot of it's around doing your own internal risk assessment in your facility, looking at where your high exposure areas are, writing down what your response plan is, and then looking at, for example, how to maintain your ventilation systems, increase your ventilation. And I'll talk a bit more about engineering controls coming up in the next couple of slides, but also around education and making sure that your staff are aware of your requirements as a business owner, to educate them as to, how do you provide a workplace free of known hazards. And the challenge for many businesses, they don't realize that COVID-19 is a known hazard recognized by OSHA, and as a result, you have to manage that hazard in your workplace and take steps. And OSHA has laid those 10 requirements out. But I'm not going to go through this, but I'm going to use this as your Easter egg, as a former safety auditor. These are the types of things that I'd be looking for if I was going into an organization to provide a risk management-based solution. So I've looked at this in relation to OSHA, the exposures of OSHA in terms of what do I need to do to meet compliance? How do I prevent an occupational injury? What do I need to do in terms of how to put a strategy in place in terms of fatality and multiple fatalities? Because definitely this particular virus does have the potential to create that. What impact does it have on workers' compensation and your EMR rate if you have a safety incident in the workplace? And then operational management. For those companies that are service organizations working for bigger organizations that have safety metrics, again, having those incidents, that's affecting your total recordable injury rate for those organizations bigger. What impact does that have on future contract awards as well? And then as we start to get into the civil negligence, what if someone does get seriously injured? What if somebody does die on the workplace as a result of contracting COVID-19? All things to consider, and I've offered those blue questions at the bottom there to sort of just provide a thought leadership on that, and let's think of what you can do to mitigate those exposures. As I said earlier, we're looking at people, we're looking at environment, assets, and reputation, not just how do we prevent people from managing COVID, because as business people, there are obviously a lot more things to manage in terms of exposure than just making sure everybody goes home safe every day. So when I look at risk management to improving safety, there's a very common, beyond just compliance with the laws and the regulations of the land, in risk management, we have what's called a hierarchy of controls, starting with elimination. So if you look at the elimination aspect, we've worked from home for a good part of this pandemic as a strategy, but eventually we can't eliminate it forever. So as we're starting to come back into the workplace, and a lot of organizations we're already back into the workplace, we are looking at other controls. So from a bioengineering perspective, vaccinations are a leading driving prevention measure and mitigation measure that we're putting out there. But primarily as we get to the administrative controls and the PPE, social distance, sanitizing practices, masks. As you start to get down to the bottom of controls, they are considered the weakest of controls, primarily because they're behavior-based. It relies on behaviors and accountability to those behaviors in order to ensure that those barriers are effective. And if I come out of the oil and gas industry and the nuclear industry, we wouldn't even consider administrative controls and PPE as competent barriers that I could put on my risk management chart and say, I can rely on those. But when we're dealing with this, and that's why it's a challenge, because we've been reliant on those behavioral controls and they all contribute. But as the narrative changes, we really need to look at more. If we can't eliminate it and we can't substitute it, the most competent barriers to put in place are the engineering controls. So when we look at the engineering controls in place, I'm putting this couple of slides and just go through some of the technology to provide some clarity as to what the technology does, because every single day there's a lot of people trying to put technology into their environment and they're spending a lot of money, and there's a lot of confusion as to what the technology does, because everybody tells you that their mousetrap is better than the other person's mousetrap. So I'm saying this from a perspective of, all of these technologies have, I kind of use the analogy, the right tool in the right toolbox for the right solution. But I know my flathead screwdriver can chisel a piece of wood, but that's not what it's designed for. So it's the right tool for the right scenario. And when I talk about engineering controls, especially when you're dealing with the indoor air, we have passive controls and we have active controls, and I'll go through some of these now. So I want to talk about ventilation, and I'm just going to play a short video for you, and just so you've heard CDC recommend we have increased ventilation, increased air changes per hour, and But I want to just play this short video. I think this video by one of our other distributors captures that they're very science orientated, but because air is very much like a fluid in terms of how it behaves, I thought this was a very good video to play and just explain the dilution problem.
Do you ever wonder just how effective your ventilation system is at keeping you safe? Unfortunately, many manufacturers' claims are misleading. Here's why. Ventilation rates for rooms are measured in air changes per hour. People typically think of this as the number of times per hour that the air in the room is fully replaced with clean air. But that's not how it works. If your room has 10 air changes per hour, that means that every 6 minutes, an amount of fresh air equal to the volume of your room has come in through your vent. But the second that fresh air enters the room, it starts mixing with the dirty air, and so what leaves the room is a diluted mixture. Let's look at an example. Imagine that this glass is a room full of air. Science considers air to be a fluid because it moves and mixes in the same way. A single drop of blue coloring is analogous to a sneeze, filling the air with the blue virus particles. Watch what happens when we pour a glass of fresh water into this one. See how the force of the water falling ensures that the fresh water doesn't just fall off the top of the glass. Instead, it rapidly mixes, and it's diluted water that then falls off the top. Look at how much dirty air is left after
Oh, we got a freeze there. Let me play.
a supposed air change. Now let's see what happens when we do it again. After 2 air changes, there is still a significant amount of blue. If that blue were poisonous, would you drink from the glass? Let's speed this up. Even after 4 or 5 air changes, there is still significant coloring. Only after 6 or 7 air changes does it start getting down to the barely noticeable point, and even then, you can still see some blue. Now imagine that that blue was infectious virus particles. Makes you think, doesn't it? Now, let's try this again. What if we have a room full of contagious virus particles, but now we have something that can neutralize that virus? Let's take advantage of the mixing property. As soon as we put the neutralizing compound into the room, it spreads and deactivates the pathogens. Suddenly, with less than a single air change, you have clean, breathable air. This technology exists, and it's called ActivePure. To find out more, go to www.
Okay. So when you look at air changes per hour, this is something that's on the CDC website. They're recommending that for different businesses and different environments. If you go to the CDC, you'll see their recommendation for types of whether it be hospital environments, healthcare. But when you start to look as to how much air changes per hour is required, but the point I wanted to make with this particular side is if you look at the time required to removal of pathogens in the air to 99.9% efficacy, you can see how many minutes that actually takes to happen. Now, I think for most of us, we understand that if we're socially interacting with somebody in a workplace, I'm not waiting 52 minutes for the air that I breathe or the air somebody else breathes to get recirculated back to possibly be clean. So that's kind of a 1940s approach to sort of air filtration as it's come out. You've heard about the increasing of MERV 13 to MERV 8 filters, which is common in most businesses and commercial HVAC systems. And again, a CDC recommendation on the basis of Azure to go to MERV 8 to MERV 13s. Certainly, it's a good idea, but the challenge is it's potentially reducing air changes per hour. Plus, we're increasing a whole lot of costs into the workplace. One of our customers up in New Hampshire was spending $8,000 a quarter, but now spending $48,000 a quarter for MERV 8s. Loss of air pressure potentially, increased power demands, and increased pressure onto older HVAC equipment that can't necessarily cope with that. But again, noble cause intent, unanticipated consequences apply in relation to filtration, but it's still, the attempt is to, much like masks, prevent the spread of pathogen, but certainly a challenge. There's UV lights that are out there, so other UV lights or UV lights that are in the track to possibly sanitize airstreams. UV lights traditionally have been used in HVAC systems to inactivate mold that grows on the heating and cooling packs. But the cons are they certainly build up quickly, episodic in approaches and used to hospitals. They use the portable devices that are out there as well. So UV light is certainly one that's out there. Bipolar ionization, I'll leave a link there to the Boeing study that's out there. Bipolar ionization is something that is being used a lot, but certainly has some challenges, and I'd encourage people to investigate and have a look at that. Bipolar ionization traditionally used pre-filter to positively and negatively charge the air to make smaller particles, bigger particles, so the filtration can capture that. But have a look at that in a bit more detail. Active Pure is probably more of a proactive approach. Proactively treats the indoor air and surfaces by putting particles into the air that neutralize pathogens into the air real time. That's basically an advanced process of advanced photocatalysis, originally designed for the space program. But what I like about the Active Pure solution is that it's proactive and it addresses the failure mode, if I'm using a safety term, or the mode in which the pathogen enters into an environment. So it is a safety solution that matches the failure mode. What I would say as I sort of conclude this is look for organizations that are willing to do real world testing to support. Always ask to say, are you willing to do real world testing? Do you have real world data that you can show? And because it's not like, I use the analogy of chlorine and water. We know that chlorine sanitizes water, but do we know how much chlorine to put in, say, an Olympic-sized swimming pool, a lazy river, etc.? So that's always the challenge in these environments as well. And then obviously look for business case examples as well, not just about how effective it is. Is there data from those customers, from those vendors that actually shows after they put something in play, does the customer have the benefit in terms of, for example, absenteeism? Does that reduce? So I'm just going to finish with five questions I think you should consider. Does the technology inactivate pathogens in the air and on surfaces? Does the technology proactively 24/7 and adapted to your workplace, putting molecules out that is sanitizing that environment? Is it trusted for indoor spaces? Some of the solutions you can't use, like UV light, and in some you can't be in there at the same time. And is the technology used? Is it cleared by FDA? So do they have products that have been cleared as, say, a Class 2 medical device, both for efficacy and safety? And does the solution, do the people who are rolling out the solution have the skill sets and the effectiveness to be able to design a solution for the real world? And if you can answer all five of those, then I would say you have the right technology partner to help drive your solution. So with that, I'm probably a little bit over time. I apologize, but I'll hand over.
Thank you, Daniel. Thanks, Glenn. Okay, great. So we are now going to go to Ellen Shanahan. Ellen, take it away.
Okay, let me get set up here to share. There, can everybody see that? Great, okay. So I am Ellen Shanahan, and I specialize in personal growth and business leadership and team building. I'd mentioned I almost wore that same outfit today and realized what a faux pas that would be. Did made a quick change. I am certified and trained by John C. Maxwell, who is the author of 100 best-selling personal growth and leadership books. He's a Horatio Alger Award recipient and was named Inc. magazine's #1 global leadership expert. I've also worked extensively with Tony Robbins as in part of his Business Mastery, his Leadership Academy, and Platinum Partners programs. And I'm also a level 2 DISC behavioral assessment consultant with Personality Insights. But I guess I should own up that my other life is as a professor at Berkshire Community College, where I've taught for 35 years. And it's what got me really interested in leadership and personal growth, working with my students on an individual basis. So when I look at what's happening in 2021, in November, well, for those of you that are business owners and leaders, there's an old adage that the harder I work, the luckier I get. And I would imagine that for most of you right now, that you ought to be pretty lucky because you've been working really hard to sort out this pandemic and how it's going to affect you. So you're probably not feeling really lucky at this moment. In October, Time Magazine ran an article with the headline, "Why Everyone is So Rude Right Now." And certainly the news has been running a lot of stories about similar incidents that have happened since. The article notes that the Cleveland Clinic uses behavioral contracts when patients' behavior is repeatedly difficult. In 2017, they issued 9 contracts. So far in 2021, they've issued 111. Dr. Bernard Golden, author of Overcoming Destructive Anger, notes that the prolonged pandemic has had a damaging effect on mental health. Plus, many have the added pressure of being isolated, having few or no resources, illness and death of loved ones, and a continuing lack of social support. On top of that, we've noticed the difficulties that employers are having hiring. The Help Wanted section of the Shopper's Guide is loaded with jobs of all types and backgrounds, and we see now hiring signs everywhere, and that creates a lot of stress, a lot of anxiety for business owners and leaders like yourselves. Just when it seemed like the pandemic was going to pass, other things happen. First, it's not over. Then we have shortages of product, shortages of staff, delivery delays. People sense an added frustration that now they think they can go out and shop or eat, but that they find that normal has been delayed, if it ever will return. Golden noted that it's displaced anger being displayed. They're angry about other things, but they take it out on those encountered with caregivers and with servers. You and your staff may be on the receiving end of that. So psychologists have suggested, in addition to giving staff training to deal with irate customers, that people try to slow down, breathe out more slowly, lower your voices when encountering difficult social situations or irate people to avoid making the situation worse. In other words, anger management. I find, however, that a few additional details may help you and your staff and your customers to stay sane and even prosper at this really challenging time. And we all know that on top of everything we're going through right now, the holidays just add more pressure to it. First, consider what Tony Robbins refers to as the 6 human needs: certainty, variety, significance, love or connection, growth, and contribution. The last 2 tend to be quite positive ones. The first 4 depends on how we use them. If I am significance in terms of a gang member who's pointing a gun at somebody, they immediately get significance with that person. They have a level of connection to their fellow gang members at that moment, and they have a fair amount of certainty that the person who's being aimed at will do what they want. So that's kind of the negative side of it, and the person who's under aim has no certainty, senses fear constantly, and has no level of love or connection at that very moment, except maybe seeing their life pass before their eyes. So the top 4, when you think about achieving your needs, perhaps you need personally a level of certainty. Perhaps you need to feel like you matter, that you are contributing. What does your staff need at this moment? And what do your customers need? They buy often based on these 6 human needs. Helping them to reach those needs likely may be more appealing to customers and easier for you and for your staff than being salesy. We also recommend for business owners focusing on your business itself and your whys. Many times being forthright with yourself about why you started a business will help you focus on number 4 and 5 and may serve as a reminder that much of the process is really problem solving and often collaboration, not necessarily just bringing back the old days or staring blindly into the future, as I think a lot of people feel they are right now. How many of us pre-pandemic could have imagined how much work could have been done at home or anywhere? Daniel's out there in other parts of the country, anywhere via Zoom. So life has changed as we know it, and some things that have come to be viewed as kind of negative. I know we're all pretty sick of webinars on Zoom, but it's actually a moment that we may not have ever had to share with other people in person if we had to balance our schedules to make those trips. So in terms of communication, a lot of problems that we face really are a matter of communication, or maybe I should say miscommunication. One thing to keep in mind, whether we're working on our personal situation or in our work environment, is that we do not all speak the same language. Our DISC behavioral assessments that we do provide an opportunity to better understand yourself as being, for instance, either task or people-oriented, or perhaps being outgoing or reserved. The language that serves me as an outgoing, influencing type who really loves people is not going to be the same language that serves and motivates and connects someone who's cautious and much more task-oriented. So being able to understand behavior and choose your words carefully is really vital, as is understanding how you respond under pressure. And we all respond differently when we're under pressure than when we're relaxed and smiling and being jovial. This goes hand in hand with taking time to listen and understand. It never hurts to begin by saying, thanks for sharing that. So if I understand what you're saying, you'd like, and then going from there. People like to be heard, even if the ultimate outcome may not be exactly what they had hoped for. Likewise, making sure that your message is clear. This applies to personal messaging and marketing messages. I'm always on my students. I see what they post on Facebook, and it's say to them, do you ever think that if your boss saw that, or your future employee saw what you just wrote about your current job, that they would ever say, that's the person I want to hire? Think twice. But it really goes much farther into marketing messages. Nordstrom has a very different message for marketing than Walmart does. And they attract, in most cases, a different audience. And that may seem obvious, but if you mix your messages to attract more people, sometimes the customers get confused. While everyone else around you may be rude, try not giving into it yourself. You can think maybe later when you think, you can gloat on it a bit that you remembered and they didn't, but you just never know what a person is going through at that moment. And even the most preoccupied person can realize later on that you thanked them and that you communicated caring to them. So be sure to offer that even if they don't offer it back to you. Pay goodness forward. It's another way of saying the golden rule, really. Contributing to others or to yourself doesn't necessarily require wealth. There are many ways to contribute, and in the end, they likely all will feel good. One of the ways we help people is with prioritizing time. It's really popular right now to talk about time management, but that's really a misnomer. We all have the same 24/7. It's how you prioritize your time that makes a difference in reaching your personal and your business goals. A lot of experts tout establishing a morning ritual. It can include meditation. It could include spiritual time, exercise, reading, planning. Reading is important. As the saying goes, leaders are readers. So it's important to include some time for that. There are a lot of readily available tools that you can use to help you stay on track. And many of them are right there on your phone. You can use Facebook Live and Reels, other live streams. It's a great way to attract customers. It's kind of spontaneous. It can even attract employees. Young people are especially drawn to the visual as opposed to the printed or the written word. So it's something to keep in mind. And as long as we're talking virtual assistants are available locally, they're available online, and they're a great way to fill in when you have a really great idea, but you have no idea how to bring it to fruition. You can waste a lot of your own time trying to figure out how to build a website, but there may be already somebody great in your community. I know we've referred people to some really great web developers in the Berkshires. We're a very rich environment for that, so shop local for that as well. But I'd also mention that when you're getting started, there are also virtual assistants that are online. My students have been referred to Fiverr, which is an app. I have a picture of it on the side. And Fiverr is a great way also for them to get their services out. So for a young jingle writer who wants to help other people pass their message on with a really catchy commercial jingle, that's a great place to start to look. When I'm also thinking when we're looking at ways to organize, that your cell phone can be your friend. I've got a screenshot there of my calendar, which I tend to color code depending on the activities. A few years ago when my mom was ill and when she was dying, I spent a lot of time on the road to Connecticut with her, and I had her life was color coded in there too, so I could keep track of her appointments and things. And it did reduce my stress, just that I could take the time to figure out what I was going to do. Anything that can be shared is great. I use notes and reminders the same way. They're on my iPhone, they're on my iPad, and they're on my laptop. One of the simplest ways that you can keep track of time prioritization that you may have seen is the Covey quadrant. It keeps track of what's important and urgent in quadrant 1, important but not urgent in quadrant 2, not important but urgent in 3, and not important and not urgent in 4. A lot of people spend a lot of time talking about quadrants 1 and 2 and the perils, especially of 4, because if we spend a lot of time in 4, a lot of times we don't get to the really important and urgent things that we get to. But when we look at a time where people are really stressed out, you need to spend some time in quadrant 4. You need to be doing those things that maybe are relaxing or just take your mind away. The catch is not to spend an hour or two in quadrant 4, but maybe 10 to 15 minutes, just something that is going to give you the opportunity to clear your mind, get your focus back, and move on. I'm not going to spend a whole lot of time here, but one thing we advocate is creating a raving fan culture, not just for your customers, but also for your staff and for yourself, because sometimes in the throes of business, we forget why we got into this. You may have to go back to the 5 questions that we asked earlier to instill that kind of energy that you had when you started out, but that energy coupled with trust and with respect are really key to developing a culture where staff help to promote your business and bring you great customers who in turn become raving fans and bring you more customers. It's really about adding value. It's about being a person of value, adding value to others. You want to know your customer, their avatar, know your team, and then make sure that your team is located in your organization where they work to their strengths and their significance. Sometimes we end up with great people in the wrong job, and it may be a matter of shifting them around to another location within your business if you have a large enough staff to do that. We offer assistance with individuals and businesses with coaching, training, and keynote speaking. We offer multi-session masterminds that we can arrange as individual coaching sessions or to bring in debriefs or trainings for owners and managers. Our DISC assessments are invaluable in understanding yourself, your employees, current and prospective, both, and your sales prospects. We do benchmark and interview reports for hiring members. We actually have a system where we can determine what the benchmarks are. We can work with you, with people you are thinking about hiring, to see if they fit those benchmarks and help you design interview questions that will really kind of get to the nitty gritty of what you need to know about that prospective employee. We also have sales and sales leadership assessments, and my favorite are the college and career assessments that I do with my students at PCC. It not only helps to steer the students to what areas of careers they might pursue based on their interests, but it also, again, goes back to their communication style and how to work with and talk with and communicate with somebody who has a different style than you do. And lastly, we annually host John Maxwell's Live to Lead event, where major world experts on leadership and personal growth come together. Our 2021 L2L people were Jamie Kern Lima, who was the founder of IT Cosmetics and sold it for billions of dollars. We have personal and executive coach and best-selling author Valerie Burton, author and entrepreneur and business leader Jeff Henderson, who you may know as the author of the book For, F-O-R, and of course, John Maxwell. We can even bring Live to Lead into your business, your nonprofit, your church or synagogue, or basically any organization that you feel would benefit from hearing that broadcast.
Great, thank you, Ellen.
Sure.
Next up is Ken from Community Health Programs.
Thanks very much. I am Ken Faber, not Farber, but Faber. It's all right. My whole life, people have been calling me that. No worries. And I am the Chief Medical Officer at Community Health Programs here in Berkshire County. And it is it's really fun for me to talk. This is not a group I usually get to talk to. And I love the question of how do we create a healthier place to live and work during the winter. It's a huge challenge, and it's really exciting for me to be part of the discussion. So I'll go ahead and share my screen, and hoping you all see that. Now I'm hoping that I can actually advance the screen. Maybe not. Okay, well, you can see it, but I'm afraid that's all you're ever going to see if I can't figure out how to advance it.
Did you start your slideshow?
Yeah, that would be a heck of a good idea, or something.
I only know that because I struggle with myself. There you go.
Okay, so my talk is going to be kind of a synthesis of the two that you've already heard, because I am going to talk about COVID, and I am going to talk about some of the predictable and maybe not so predictable effects of that on our health as a community. So just in case anyone wondered whether COVID had gone away in the Berkshires, the answer is it has not. In fact, this week's statistics show that new cases are higher than any time since January. And that while our percent positive is lower than a lot of places in the country, our percent positive testing around 3%, it has gone up. It has gone up considerably in the last few weeks. Along with that, our number of confirmed cases has gone up. So for an area our size, having 600 confirmed cases in the last couple of weeks could actually put a considerable strain on our very limited hospital capacity. So it is important to remember that even though we are a small community, we also, being a small community, we also have very limited medical resources. So it's really incumbent upon us to do all the things that Daniel talked about in protecting ourselves, to look at innovative technologies. But COVID, unfortunately, has not gone away. It's important to remember that even though it's COVID all year long, every day, this is also flu season, and flu kills people too. And if you look at the number of flu deaths over the past 10 years, they have varied. And 1919 to 20 was a really good year for flu. And the reason it was a really good year for flu is because everybody was masking, and because people were staying inside and staying isolated, I should say, not necessarily inside, but isolated from each other. So just like COVID, flu is a virus. It's a respiratorily transmitted virus. So anything that we do to prevent respiratory transmission and vaccinated against it is indicated. Unlike the COVID vaccine, the flu vaccine has never had the success rate because flu changes every year, and we try a year in advance to find the right vaccine. And sometimes we're right and sometimes we're wrong, but still very important to get vaccinated. Yeah. If you look at a comparison though of who kills people more, flu or COVID, you can see that COVID is the unfortunate winner in that, especially in the older age group. Whereas about 1% of people who are in the older age group will die from flu. Over 10% will die, who get COVID will die from that infection. So it's just so important that we prevent transmission. The thing that we also know though, and really building on what Ellen said, is that isolation is another huge risk factor, especially this year and especially this time of year, and that isolation impacts mental and physical health. So whether it's isolation from quarantining, or isolation because of work from home, or isolation because of just trying to be safe and not hang out with a whole lot of people who may or may not be vaccinated, isolation is really dangerous for people. And we know that, especially for seniors, that even before COVID, that 43% of seniors felt lonely on a regular basis. Just think about that. How many people all day, every day feel lonely? Loneliness is a preventable and dangerous condition. It's a factor of how we live today, even before COVID. You can tell I'm an infertility doctor because I said clomid as opposed to COVID. How we lived before COVID. It's the fact that older people are often segregated into environments where they don't get a chance to interact with anyone, or if they do interact with people, it's other people who are also very weary of interaction. That illness prevents people from interacting, and it's a dangerous condition. We know that people who feel lonely also have a 45% risk of mortality. So of dying in a single year that they report being lonely. And that if you look at loneliness compared to other risk factor, loneliness is more dangerous than obesity and as dangerous as smoking 15 cigarettes a day. So loneliness kills people, and it is preventable. We also know that low light conditions increase the risk of depression. So many of you have heard of a condition called seasonal affective disorder. It's been around a very long time. And that seasonal affective disorder increases the risk of depression. And that, again, it is not an entirely preventable condition. There are treatments like light boxes, even use of antidepressants. But one of the cures for seasonal affective disorder is providing other ways of stimulating somebody through social activities. So if you look at, this is titled Winter Health Watch. If you look at all of the things that are adding up this particular winter as risk factors for poor health and unhappiness, it's COVID, being sick. It's the fact that every single winter, or low light conditions in this country, we are at the risk of seasonal affective disorders. It's the isolation, either caused by COVID or just inherent in our fractured society. And what else are we doing? We also are in a time where people are giving up their jobs, and they're not giving up their jobs because they're getting fired. So it's not involuntary. They're giving up their jobs because they are burned out. And why are people burned out? People are burned out because of the stress of the workplace. We'll talk about burnout a little more in a minute, but especially in healthcare, where over half the people that leave their jobs in healthcare are because of burnout. And this is across the spectrum. This is everything from physicians to medical assistants to receptionists. And the reason they're burned out is, again, a lot of what Ellen was talking about in our failure and ability to communicate our stress in ways that isn't destructive, but it's also in the increased stress of having to worry about getting sick. It's the change in activities that is required by taking care of a lot of sick people. It's the isolation that's provided through, having to, we don't eat lunch together anymore. We don't gather for meetings. We don't go to meetings. We pretty much either are taking care of a patient or we're in our office and masked. And that the other thing that's causing burnout are people leaving the workplace, because every time somebody leaves the workplace, it means everybody else has to work harder. So the vicious cycle of, in our case in healthcare, of the great resignation, but also in other industries, is that people leave because they're burned out. And when people leave, their former coworkers are at increased risk for burnout, and then they leave too. So it is a really, really challenging situation when so many people are leaving voluntarily to treat their own need for health, because it then causes other people to have an increased risk themselves of burning out. Relatively few people are leaving because of compensation. I can tell you that in our organization and in healthcare in general, the people that are the hardest to recruit are not physicians. They're medical assistants and dental assistants. Our organization will do anything to hire a qualified medical assistant. In fact, we'll do anything to hire someone who has potential, even if they're not actually certified, and then we will train them. We're paying people the starting salary for a medical assistant before, a year ago was about $16 to $18 an hour. We are commonly offering anyone who has certification up to $25 an hour, because we're not competing with other organizations hiring medical assistants. We're competing with anybody who will hire someone. We're competing with Dottie's Cafe and Dunkin' Donuts and Uber. I mean, we're competing with anybody who is hiring people in that salary range. And it's a good thing, by the way. We should be paying people more. We pay people too little to do a really, really important job. But that's where we are. And let us not forget the holidays, because if we didn't have enough stress, it just so happens that there are a couple of holidays that happen in the winter. Just when you're feeling really bad about yourself, you get a chance to look at everybody's social media of them having the ideal Christmas or Hanukkah or Kwanzaa, and saying, gee, my life really sucks. Look at all those people. Apparently my life is the only one that sucks. And so we are looking at all of those factors as real risk factors for having people being very unhappy and unhealthy this time of year. So what's our call to action? Our call to action is, first of all, do the easy things, just like Daniel was talking about. Do the easy things. Get vaccinated. If you're in a risk group, get your booster. Encourage other people to do the same. And then, and not just against COVID, but against flu. And oh, by the way, there's a whole bunch of other vaccines that people tend to fall back on, or fall away from for the senior population, things like shingles and pneumovax and hepatitis B. Don't forget about those either. All of those are covered by Medicare, and every other insurance are covered by Medicaid, Mass Health in the state. So please get those done. And I think we need to support and celebrate those things that people do that reduce risk. One of my things in coming to CHP, and I've been with CHP for about 6 months now, is when I would go to an office and I would see signs on the door basically yelling at people, telling them to wear a mask. Wear a mask, darn you. Assuming, one, that people didn't want to wear a mask and that we had to yell at them to do it, or that they weren't already wearing a mask. So what I asked is, what would a message look like that would celebrate the fact that the office is entirely vaccinated and all of our offices are entirely vaccinated, and that we would love you to wear a mask to be safe. So we changed our signage. I actually have something that I meant to include in the presentation I'll bring up in a second, to make it welcoming, assuming that people want to be healthy and thanking them for doing that, not yelling at them because they might be one of those people that we're pretty sure wants to kill us. And that's the sort of celebration I'm talking about. Encourage people not through discipline, but through celebration. And watch for signs of burnout. It isn't good enough to tell people that if you're feeling burned out, you should let us know. Or, if you're feeling burned out, you should take a yoga class, or you should meditate, or you should join an ashram, or you should, have better work-life balance. And then the next minute we tell them, oh, by the way, I will be sending you emails all weekend long. You don't have to read them, but I will be sending them. Or there actually is no end to your day because people always need you. Or couldn't you just avoid, not take your vacation because we're really short-staffed? That really isn't good enough. What we really need to do is look for signs of burnout. So we need to make rounds. So every week I have a schedule of where I go, to what offices I go, and who I talk to. And I make it real clear that, I'm not just talking to you because I'm not checking on you that you're doing your work. I know you're doing your work. I'm there to see how you're doing. I'm there to ask the questions around burnout and around another term that's very popular in our industry that came from the military called moral injury. Ellen, I don't know if that's a term you're familiar with, maybe in our discussion, but the idea that we sometimes inadvertently put people in a position where we ask them to do things that are in conflict with all of their ethical and moral beliefs. Like we say, take care of a patient without really having an efficient computer system or information to do it. And what we're really telling them then is take care of a patient unsafely. We don't say that, but if we don't know that's what's happening, if people don't tell us they're in that position, that's the message we send. So if we don't go out and actually look for that, then we'll never know. And you don't have to just be in a medical field to do that. I think it's really incumbent upon all of us who are in leadership positions to check in with our workforce, to ask the questions relevant, to know whether our folks feel isolated, depleted, frustrated, sad, angry, whether they're sleeping, how they feel Sunday night when they have to come to work. Are they looking forward to it? Or is it like the worst day of the week because now they know they have to come to work the next day? That's really on us. It's not really good enough to just say, well, you can always tell me, I have an open door. Send me an email. It really is on us to look for that. And if we're really going to give the message to our folks that we care about them, we love them, we don't want them to leave us, we don't want them to burn out, that's what we have to do. And it's in our best interest. So what this is about, and Ellen, I really didn't steal the slide from you. I really did have this before. It wasn't like putting the slide presentation together when you were talking, but this really is what it's about. It really is about creating connections. And those connections are really challenging in a virtual workplace. There are some things, evidence-based things we can do that let people know, even though we never see them, that we care about them. There is this thing called Amazon or internet, and we can actually send people appreciation without ever seeing them. We can just tell them thank you. Thank you through a Zoom call is almost as good as a thank you in person. It's entirely meaningful. We have the ability to create innovative solutions for workplace problems. And the more we ask people to contribute to that, the better solutions are going to be. So we'll give an example. We have a wonderful electronic health record that drives people crazy because small things, when they're broken, stop people from working efficiently. And we had a rather Baroque system where if somebody had a problem, they would send a ticket in. The ticket would get worked by some anonymous, talented person, and then the issue might get solved, but then only get solved for that person. So rather than that, we put in a system where we now escalate this to a dedicated person on site who then, if they don't have the power to fix it, they immediately send out through their, phone a friend network, ways to fix it. And all of that is very transparent. So people can see the progress of their work. It's not just going into a black box. It gives people the power to know, to take away that uncertainty that you were referring to earlier, because uncertainty doesn't generally make people very happy. We should celebrate, and we should, when possible, celebrate together. Celebrate over a meal or a event or a shared, dress your dog up for Halloween. I mean, anything that gets people to get their minds out of, it is that quadrant 4 activity, which I've never thought of quadrant 4 as a place to celebrate, but it is. It really is something to celebrate. We should share our vulnerabilities. We should not pretend this is easy for any of us. This is hard. This is so hard. We are all struggling. It's okay not to be okay. These are the messages we, as leaders, that we need to give to our folks so that we give them permission to say that also. And this is all in the realm of fostering psychological safety. This idea that when you come to work, we want you to bring your full self, and we know that means that you need to speak up. You need to speak about what you're seeing. You need to be the person who, you need to be comfortable in challenging authority. You need to be able to express what is true for you. That gets people involved and makes them feel appropriately like they are part of the solution. And it takes away that sense that what I really need to do is hold on to all of my grudges and all of my history of, grudge is a bad word, to hold on to all of what is contributing to my frustration. So instead of being on the sidelines, it's just a lot more fun to be in the game. And that's a message that I try to give every time I meet with people, is that I know there's a long history of reasons why you shouldn't trust me, but you should trust me anyway. Until I do something stupid, in which case you should still trust me and just assume that I was too stupid to know the right thing to do, so I did the wrong thing. And the thing that I will tell you that we're all about is that we promote wellness. So I hope all of you have seen this at one point, driving through your neighborhoods, the big orange bus. This is our most visible symbol of how we promote wellness. We use this before there was COVID, we actually used this for a lot of things, but since COVID, we pretty much use this to give vaccines. And we've given thousands of vaccines, thousands and thousands of vaccines to anyone who's willing to get one. You don't have to have insurance. You don't have to be a CHP member. You don't have to work for anyone. You don't have to live in Berkshire County. You don't have to live in Massachusetts. We'll give vaccines to anybody who needs one. We're giving flu and COVID vaccines right now. But that's not the only way we promote wellness. We promote wellness through trying to invite people into getting care in how they want to get it. So whether that's through telehealth, through group visits, something we're really trying to understand and harness the power of group visits, through traditional face-to-face consults, through behavioral health only consults, through whether it's with pediatric population or the adult population. We promote wellness. We believe very strongly that that is our mission. We do that regardless of financial ability to pay or social station. We reach out to immigrant communities, which we will have a larger immigrant community soon in Pittsfield from Afghanistan. We reach out to the homeless, to the formerly incarcerated. There is nobody that we do not want to see, and whether that's through medical care or dental care. This is our mission. Our biggest challenge today is not actually treating COVID. We know how to treat COVID. Our biggest challenge is in managing and the downstream effects of COVID, the isolation, the social stigma of those who choose not to be vaccinated. That's our challenge. And that's something that I think all of us in the community can come together and work towards reaching out to those people who are really suffering the non-medical, but just as devastating effects of this pandemic. So thank you. Thank you so much for your time. I really enjoyed hearing the other presentations. I learned a lot, and I think I'm the last speaker. So now I will put it back to you, Betsy.
Thank you, Ken. And thanks to everybody, Ellen, Daniel, Glenn, all of you for taking the time to be here today and to, share your view of this topic. And thanks so much to Lee Bank for being our sponsor for this event. And we will share this on our e-news and also through social media and on our website. So thanks again, and everybody have a great day and stay healthy. Thank you.